Hey, it's Dr. Ryan French. If you think you might have migraines, this will help you. So there are 4 different stages that somebody with migraines tends to go through, and some people only really feel 2 of them, maybe 3 of them, and some get all 4. So the first one is called a prodrome stage. So a prodrome is usually 1 day or maybe 2 days before the migraine, and people will notice a change in their physiology. They'll notice a change in their digestive system, so either constipation or diarrhea. They'll notice a change in maybe slight changes in their speech, maybe slight changes in like irritability or depression type symptoms. Some people even feel a little bit of a stiffness in the neck. And then, so the second part is the aura part. And they say maybe 20 to 30% of people get this. And this is where they see like flashes of light, or they see they're losing like a blind spot in their field of vision. They notice a change in their speech. And I even have a couple patients that they get tingling in the arms or the legs. So I have a patient who, she always gets tingling going down the arm the day before a headache. And then the third stage is the one you can't miss. That's the full-on headache. It is incredibly painful. It's debilitating. There's a throbbing pain. A lot of people get nausea with it. They get vomiting. Some people have a blurring of vision. So I have a couple patients that lose vision in one of their eyes. They get lightheaded. And then there's the post-drome stage, and that's the recovery stage. And the recovery stage, for some people, they're totally exhausted and wiped out and they need to sleep. And other people feel a bit of a sense of euphoria that the headache's over. Just like some people after throwing up, they feel drained, and other people after throwing up, they feel better. Everybody's a little bit different after it's over. If you feel that you might have migraines, one of the things that you can do is check back over some of the previous videos that I've done that have shown you a number of different things that you can do at home. But the main things are know your triggers, figure out what those are, and change your life around it. Don't tempt fate. If you know that chocolate's a trigger, don't try it just the once. Almost always our patients pay for that. The second thing is that if you have a stiff neck before you get the headache, make sure you get your neck checked by somebody who's qualified to look at it, because the nerves that come from the top part of your neck are almost always involved in headaches. And then the last thing is keep a headache diary. Keep a track of foods you've eaten before, activities you've done before, so that you can try to figure out patterns. Once you figure out a pattern, it's a lot easier, not just for a doctor to help you, but for you to be able to help yourself. Okay? I hope you find this helpful.